Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgeons. I've been practicing in the Scottsdale, Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I perform a lot of facial rejuvenation, and I see a lot of young patients in my practice. A common question that I have is, when patients come in, is a facelift a good option for patients that are less than 40 or 40 that have lost a lot of weight and a lot of volume in their face? The answer to the question is maybe. Everybody is different, and it's very difficult to generalize about patients and their age. Patients come in, and there's a whole bunch of that goes into the presentation. It's genetics, it's habits, whether or not you're a smoker, whether or not you have a lot of sun exposure, it's your weight, and it's generally, all of that goes into what somebody's presentation is. If somebody also has a history of acne, that causes a lot of problems with regards to the skin and causes premature aging for people's age. Now, in patients that are less than 40, it is not that common that somebody would need a full facelift, but there are certain patients that have lost a lot of weight and volume that need some kind of remedy that gives a very nice natural result. If somebody loses a lot of weight, regardless of the age, whether they're 40 or over 40, and they have a lot of skin laxity, putting volume in will help that, but still you don't want to put a lot of volume in that could be distorting. So unless there's sufficient skin tone, that is enough skin tightness to provide shape to the fat or volume that we're putting in, the result will not look natural. And I think that people really want to stay away from that. There are certain patients that have lost a lot of weight, that may have had a lot of sun exposure, that don't have good skin elasticity, that actually do need a facelift, especially those patients that may have had some acne scarring where their skin doesn't have the good elasticity that they did. So regardless of the age, there are some patients that are very young that come in and they actually need a facelift. So what kind of facelift would I perform? I would perform a facelift that causes removal of some of that skin, but really causes a shift of the volume of the deep tissues up to where the volume has left. So that would be the cheekbones and along the jawline. So in those patients that are less than 40 that have lost a lot of volume, if I perform a facelift, I will perform a volume enhancing facelift, that is a SMAS facelift, along with generally some kind of volume enhancement. That would be taking your own fat into areas where I think that you need that augmented. But the best way to understand is that everybody presents differently, and age is not as important as presentation. So don't be afraid if you're less than 40, and we talk about that, because what I'm looking for is your best result. In my facelift patients, the greatest compliment that I get is that nobody can tell it's been performed. I like my facelifts to be your secret. I like the scars to be imperceptible. I like there to be no shifts of hairline, and I like you to feel confident that you can sit across from somebody and not have them know anything's been performed. Generally, I perform that facelift with fat transfer and possibly some laser resurfacing, but the best way to understand is that you need to come in and get an idea about what your options are. It could be either non-invasive, minimally invasive, or a full facelift. There's something that I've developed recently called a Gen X lift, which actually can combine many of these procedures for the younger patients that provides a short scar facelift along with volume enhancement and laser resurfacing, and that is made for patients that may not be ready for the full facial rejuvenation. But the best way to get an idea is to come in for a consultation. Thank you.